The SDP is on the national agenda, and it's very much about bringing together providers, commissioners, social care, everybody that's involved in looking after patients or residents within an area. And the area that we're in is Surrey Heartlands, which involves patients that live in Guildford and Waverley CCG, North West Surrey CCG and Surrey Downs CCG.
We know that primary care's got a problem, general practice has got a problem, as well as acute hospitals. So there's real energy to think, well, how do we actually sort of keep the quality of care and the accessibility of care to the patient good, but within the money that we've got, which does mean we need to work differently.
I think it gives us a new opportunity to really radically change the way services are provided to meet the needs of our population. So to provide more services outside of acute hospitals, to make acute hospitals work more efficiently and effectively, and to use the resources that we've got together in a way that makes best use of them.
It's a recognition that the scale of the individual organisations in Surrey Heartlands area is insufficient for current service configurations. Ultimately, it's all about improving patient care by concentration of resource, so you get subspecialisation and improved outcomes.
It's not just another fad, and I think that what's important with the SDP is it is building on a lot of really good local work. So each of the local areas is already looking at a locally appropriate model for the integration of health and social care, for supporting people with complex needs better.
An important component of our SDP is that David McNulty from Surrey County Council is chairing the Transformation Board. We have very strong participation from public health and social services to ensure that we are using all of the resources that are at the disposal in Surrey to make the necessary changes.
We've just had at the beginning of the workshop, we've got all members of the Transformation Board at chief exec level or chair level, all sitting up all together and all committing to the one plan and one budget concept, which is the first time I've ever seen that happen.
Relationships have got stronger, we're getting used to working with each other in a different way, and I feel people have really started to move out of their organisational boundaries, and we're actually looking at pathways, both clinical and prevention pathways, in a different way.
We're moving on from this idea that health and care is provided by individualised, disparate organisations which operate separately to one another and indeed in competition with one another, to a point where we're considering ourselves as a whole team, as a single system. That undoubtedly has to be good for patient care and also the benefit of wider populations, people who are not patients, people who are not yet coming into contact directly with healthcare because there's something wrong with them, but because there's actually they're involved in prevention and self-care. I think undoubtedly this will be good for that.
I think what's different is that the NHS has not delivered a mandate in terms of a template of how this change needs to be delivered. There's some non-negotiables within there, and that's the nature of leadership. And the non-negotiables are, we are to deliver sustainable healthcare for the future. How you do that is that you think locally with your colleagues, with your healthcare partners, about how to best deliver that for the population.
You know, I've been to a number of events previously that are about service transformation, and I think there's something about how we're working together and how a different range of professionals, from clinicians to some very senior service leads, and everybody's viewpoint has been taken forward and thought through carefully. So based on how I feel about my level of involvement and how included I felt, I'm hopeful that that stands a chance of cascading through.
It's been a real opportunity to hear from the different professional groups and different parts of the system about actually what's really needed, what elements are not working well. Have we got too much variation in healthcare at the moment?
So what we're talking about is having a vehicle by which we can ensure that clinical standards are the same for all residents across our geography.
The concept of the SDP Academy is very interesting, where we pool our information, pool our data, pool our thoughts.
What will make it work is teamwork, is the single vision, the single focus, and an openness and willingness to provide the solutions that are needed to drive the change forward.
Today we've had 154 people in the room from every one of the organisations. I think that's a real sign of how important people think this is, of how seriously they're taking it and how committed they are. And some of the outcomes are genuinely transformational.